Hello everyone, in this video I'm going to tell you about my jaw surgery, my lower jaw surgery, and how it went, and a couple of things that went wrong. This is absolutely not meant to scare anyone who's going into jaw surgery. It's just what happened to me, and it's a very small chance that these things happen. I was just very unfortunate, I guess. I have had my braces for over 2 years now, and the reason I wanted to get braces is because my jaw didn't close properly and my front teeth weren't aligned. They were not straight on top of each other. So I had my lower jaw surgery in December last year, and this is a picture of how my teeth were before the operation. These pictures have been taken by the hospital. There were also a lot of molds made, so the surgeon had enough information to know what he should change in the surgery. So the date was planned and I knew exactly what the aftercare would be. I planned the surgery a week before Christmas because I had 3 weeks of holidays then. I thought it would be a good idea to not miss anything from school and to have that time to recover. A week before the surgery there was a problem with the insurance. This was because the hospital made the mistake to send the wrong pictures to the insurance, and this almost caused the whole thing to be cancelled. After a lot of phone calls, I finally, 3 days before the operation, got the insurance part approved. Then the next Monday it was surgery day. My boyfriend, my mom and I were at the hospital at 6 a.m. I was the first on the list to go into surgery. This is because I have diabetes, and it is very hard for me to keep my blood sugar stable when I cannot eat or drink before the surgery. First we went into a room where I could change my normal clothes for a gown, and then I was rolled into a room where you basically just wait for the surgeon to pick you up for the surgery. When I got picked up I got an IV with salt and insulin. My insulin pump had been stopped at this point, so the doctors could take over. They could now check my blood sugars during surgery and give me sugar or insulin if needed. Then I got the narcosis and went to sleep. I always find this part where the narcosis goes into your arm a bit painful, but thankfully it only lasts a few seconds because then you're gone. So after a few hours I woke up in a big white room where I was being checked and where I could wake up. When everything was good, I was being rolled into another room where my boyfriend and my mom were waiting for me and where I would be staying the next 24 hours. At that point I was very scared to vomit because my jaws were locked shut, but because I didn't eat that day when I needed to vomit, there was no problem. It was just liquid. Luckily I was able to talk a little bit with my jaw shut, so I could express myself to my boyfriend and my mom. Throughout that first day, I just spent it sleeping and talking to my family and drinking broth, which actually made me feel a lot better. Then the trouble was starting. I was still not on my insulin pump, but on the IV. The nurses said that when my blood sugars were under control again, then I could get my pump back. But the problem was because I wasn't really eating and getting insulin like I normally would, my blood sugars were not getting better. Also the nurses were very slow with giving me the correct amount of insulin, so that didn't help either. They needed to make a phone call to another doctor every time my blood sugars were checked to ask them how much insulin they could give me, but this would take sometimes 2 or 3 hours before they would come back to me. And then when they came back they gave me way too little insulin. I remember I told them to give me more insulin, but they said they should follow the orders of the doctor. At this point I was very frustrated because I knew I wasn't getting enough insulin and my high blood sugars were really making me feel bad. The next day I got my insulin pump back because I was going home that day. My blood sugars were not any lower at this point, but they needed to send me home, so I got it back. So at this point I was being in control again. So that morning I went for my checkup with the surgeon, and they made this picture of my teeth, and then I went home. When we arrived home, my boyfriend went to the supermarket to get some liquid food. When I was waiting at home, I was feeling really sick because my blood sugars had not been under control for like over 24 hours now. So I was really feeling sick and I called my boyfriend to get home as soon as possible. I needed to go to the hospital. I unfortunately know this feeling really well because it happened to me a few times in my life already. And I know that the only option to fix it is to go to the hospital and get an IV with salt and insulin. So when my boyfriend got back home, we immediately called the emergency room. They said to me that I couldn't come directly. I should first be checked by the general practitioner. Later on, it was clear I should have ignored this advice and should have gone to the emergency room right away. But because I was feeling very bad and because the woman on the phone was kind of irritated with us, I went to the general practitioner first. When we got to the general practitioner, it was very clear that I was at the point where my body was poisoning itself and that I should go directly to the hospital. This was not the same hospital where I got my surgery. It was a hospital that was closer to home. In the hospital, I got an IV immediately and I stayed there for 2 days until my blood sugars were good again. It was a bit of trial and error those 2 days because my jaws were shut, but I still needed to get food into me because I needed the sugars. So then on Thursday, I went back home and from that point on, everything went according to plan. I'll now show you some pictures of the first days and weeks. So as I mentioned, I was having the surgery a week before Christmas. So that Christmas I couldn't really eat, which was a real bummer because there were all kinds of lovely food around me. And everyone was eating and I could only drink these liquid meals. But every week there would be more options for me to eat, and within 8 weeks I could eat everything again except for like beef and nuts. In these first few weeks I went for regular checkups with my surgeon and everything was going very well. There was only one picture made of my teeth and that was a day after the surgery. I was told then that everything went great and I should be able to get my braces off before the summer holidays. Then after 8 weeks I went to my own orthodontist to check my braces. That's when I got the most horrible news. My jaw was really not in the place where it should be. It was actually standing a bit more to the left in comparison to before the surgery, so it was even worse. There was also a huge gap between the bottom and the top teeth on the left side of my mouth. This is what it looked like at that point. So of course when I got out I started to panic and I started to cry. I called my boyfriend to tell him what the orthodontist said. He told me to come home and we would figure it out. The next day I called my surgeon to tell him what the orthodontist said. He said I needed to make an appointment as fast as possible so he could see what was going wrong. After 2 appointments it was clear that my jaw had apparently moved in those weeks between the first picture was made and my appointment with my orthodontist. It had come loose and it had moved itself into a position that wasn't planned. I didn't feel this because my whole lower jaw was numb for the first 2 months after the surgery. So here I am and the surgery needs to be redone. I have planned my surgery on the 7th of August, which will be within 2 weeks after I uploaded this video. I am of course very nervous because I hope everything goes well this time. I have already had an appointment in which I said I really wanted to have my insulin pump back right at the moment I was awake again because of the trouble I had last time. I will be making more pictures and videos this time, so I can make a video about it to document how the second surgery went and also the recovery part of it. If you are interested in seeing this, please subscribe. If you like this video, give it a thumbs up or leave a comment, and I will see you next time.